Michelle comes to us, when she first came, she had like an infection on her upper left area, and she was missing some teeth, and she wanted to have her bite restored. She had a big gap between her two front teeth also. So I told her, in order to do this, we're going to have to veneer all the upper teeth and put a bridge on the upper left, and we had to do a root canal. We also had to open her bite. By that I mean we had to use some neuromuscular techniques to find out where her jaw position, where the optimum position was where she was going to be comfortable. We relaxed the muscles, and then we took a bite registration. We waxed her whole case up, and then we put all the parts together, and this is what we have right now. She's still in treatment though. We still have work to do. She's going to require some implants on her upper right area, and then we still have to come back and finish restoring the bite. The orthotic right now is like a diagnostic tool we're using to find out if her bite is correct, and we'll find out that in just a minute.
About 3 months ago, I walked into a dentist's office. At that point, I became out of control where I could not stand to be treated, and he said, I need to recommend you to a dentistry, Thomas Gonzales, that will be able to help you. This is not the type of relationship that the dentist should have with a patient. And at that point, I came to Thomas Gonzales. I've become, for the last 2 years, having extremely bad headaches, allergies, hay fever, going to the hospital. Every other weekend I was going to the hospital. At that point, they were telling me, the doctors, that I had infection and I needed to see a dentist really bad, that my teeth was making me quite ill. 6 months into it, I could not stand to even go to work because I was having real severe bad headaches. Anytime that I would walk into a dentist's office, I would really cringe, hyperventilate, perspire. When I first walked in, I was feeling all of that. When I got into the chair, I told him, you cannot go in my mouth at all. You cannot. At that point, he built up the relationship where he said, I don't have to go in your mouth right now. So that was pretty good because he didn't push himself on me to say, we have to do this to be able to correct it. He, at that point, let me feel comfortable with him.
Well, there's several reasons. One, she did have an infection in her sinus, and that could have been contributing to the headache, so we cleared that up. But I think the more important thing was we used some neuromuscular techniques on her, where we relaxed her jaw muscles and found the correct position for her jaws. In other words, her muscles are in a more relaxed position now, and that ends that whole cycle of muscle tension headaches. I think most headaches are muscle tension headaches, and it has to do with the jaw being in the wrong position. So we put the jaw in the correct position, or more importantly, where the muscles are relaxed, and therefore a lot of things just eliminate. Things that we don't even know about sometimes, like this. People come back, because when she first came in, we weren't talking about headaches. We were talking about other issues. These are side things that people tell me. They come back and they say, wow, my headaches are gone.
Right.
My neck aches are gone. And they just feel so much better about themselves. I would say less than 1% of dentists are trained to do neuromuscular techniques. Most dentists don't even know about it. But it is very important when you're doing reconstruction work, because you can rebuild that bite to the same position. She would still have her headaches today had I done that. Correct. But now we've changed things. And we didn't even ask her about the headaches at first. This is stuff that is coming out afterwards. And like, it was a surprise to me to find out that her headaches are gone, or that she even had them. Because at first, that wasn't our primary concern. Our primary concern was getting this lady back to health. And these are side effects that people, they always come back and tell me, my headaches are gone, my neck aches are gone, I feel better, I breathe better, I don't snore as much. There's so many other symptoms that go away. It makes better people out of them too.
Yeah, it does.